Hello there everyone, today's video is all about the new health and social care levy. Hot off the press, it's just been announced today by the Prime Minister and the Chancellor and the Health Secretary. So what is it all about? Well, let's take a dive straight in. So the new health and social care levy looks to raise £36 billion over the next 3 years, or £12 billion a year. Now, most of that money will go towards funding the NHS to help them catch up on all the backlog of operations and everything else, all the treatments missed during the pandemic. So most of that 36 billion goes to the NHS. Of the 36 billion, 5.3 billion goes to social care changes. More on that in a moment. So this new levy that's coming in starts in April 2022, so not immediately. And what it is, it will start out life as an increase in national insurance. So straight away, national insurance will increase by 1.25% for both employees and employers. So employers pay national insurance, as do employees. Across the board, increase in 1.25%. Now, when I say it will start out life as that, because it will switch to not being a change in national insurance, and it will change from 2023 into being labelled a completely different tax. It'll be a health and social care levy. And this is quite an astute move, because normally in the past, let's say when the government announces increase in taxes to pay for such and such, it's not really earmarked for that, even though they say it is. Technically, it just goes all into a great big pot, and then the government allocate funds year on year. So even though they're trying to raise money for a specific thing, it just gets lumped in with all the other taxes, and then they will divvy it up accordingly. But to make this more politically acceptable, the government have said, rather than just call it a increase in national insurance, which, by the way, breaks their manifesto pledge of not increasing VAT, income tax and national insurance, but nevertheless, to make it more acceptable to people going forward, that it will genuinely be ring-fenced and find its way towards the NHS and social care, it will be labelled a brand new tax, the levy, the new health and social care levy. And on your pay slip, if you're an employee, it will be a separate line. So you will have the pay-as-you-earn income tax deducted, employees' national insurance as well deducted, and then this new line for this new healthcare levy. So you have visibility that it's being earmarked and ring-fenced, which is politically more acceptable in the government's opinion for all the millions of people for whom this will affect. But administratively, to start out life, it will just basically be an increase in national insurance starting from April next year. Class 1 national insurance if you're an employee, and class 4s if you are self-employed. But then from the year after, from October, or rather from April 2023, it will be rebranded and relabeled as this new levy and appear as a separate line item on your payslip. So, brand new tax to all intents and purposes. This levy, this 1.25%, will be paid by all working adults, including 10% of pensioners who work. So just because you reach pensionable age, you'll still pay this extra 1.25% if you're a pensioner who still works and receives a wage. The government reckon, when they've costed all this out, that the highest earning 14% of the population will basically contribute towards half of all the extra revenue raised. And it will also apply to dividends. So dividends, if you have your own company, you're an owner manager, you're a director shareholder of your own business, and you pay yourself mostly in dividends, for decades, or it's never been the case on dividends that they were subject to national insurance. Now, this extra levy, this 1.25%, will be added to those dividends. Remember, the dividends, favourable rates of tax, you get the first £2,000 tax-free, then in the basic rate band it's 7.5%. Well, this 1.25% levy will also apply to dividends. What about the social care measures that were introduced? Well, there will be a cap on social care costs starting in October 2023, so that no individual has to find more than £86,000 over the course of their lifetime to fund their care, their social care. So the cap basically on how much an individual will have to find, to a lifetime cap on the spending for their social care in a care home, and £86,000 over their lifetime. That's the cap, meaning that anything above that will be subsidised by the government. Now, anyone with assets less than £20,000, they won't have to find anything themselves to contribute towards their social care. That will be fully covered by the state. Those individuals with assets between £20,000 and £100,000, they will have their care costs subsidised. But essentially that cap says that any individual will pay no more than £86,000 themselves over the course of their lifetime towards social care, and the rest will be topped up by the government. So that's just an overview there on the changes that were announced today. As always, the devil's in the detail. I'm sure there'll be more detail coming out on this in the days and weeks ahead, and I will keep you posted on that. But for now, that's just an overview on this new health and social levy. If you like this video, please do subscribe right there. And as always, I'll see you soon.